My husband and I moved here from North Dakota when he retired in May of 2022. We built our dream home in Rio Rancho, made wonderful friends, and fully expected New Mexico to be our forever home. I knew I needed a mammogram in January 2023, so I started looking for a primary care physician in September 2022, thinking I could get an appointment in 4 to 6 months and I'd be right on schedule. Boy, was I wrong. I called clinic after clinic and doctor after doctor, only to be told, we're not taking new patients. I finally got a get-to-know-you appointment with the DO, not the MD I was looking for, but I took it just to get in the system and get a referral. That doctor was less than impressive, but at least I had an appointment for a mammogram. On the way out the door, I stopped at the counter and asked to make a get-to-know-you appointment with any other doctor, as long as they were an MD. I was told, we'll see what we can do, and we'll get back to you. I don't recall how long it took for that next referral, but before I could even see that doctor, I got a letter in the mail advising they had left. Repeat that exercise a couple more times, including dozens of phone calls to doctors in the Albuquerque Metro, Santa Fe, and other areas. Finally, in October of 2024, more than 2 years after we moved here, I spent 2 full days calling every doctor's office and clinic I could find. All of them said, we're not taking new patients. One of those calls was to UNM. The lovely woman who answered the phone said, honey, you're going to have to wait. I said, okay, that's fine. We're healthy. We're not in a hurry. How long is the wait list? Her response, at least 2 years to get off the list, and then another 6 to 9 months to get an appointment. Out of desperation, I put our names on the list. It's been more than a year. I haven't heard anything. Earlier this year, I was ill and needed to go to urgent care. I left my house with a list of urgent care clinics in my area. The first one told me I needed an appointment. The next one was closed that day, with a sign stating virtual care only, despite the fact that their website said they don't offer virtual visits. I arrived at the third one at 11:45. They said they could check me in, but I have to come back after 1 because they were going to lunch. The fourth one was out of business. On try number 5, I finally got into an urgent care, and they called the script into their pharmacy. It was another 3 hours sitting outside waiting for a script to be filled. When you're sick enough to require urgent care, driving to 5 clinics and waiting for hours for prescriptions to be filled is frustrating, to say the least. My husband and I are in our 50s, and we are fortunate in that we're in good health and are in a position to have options. Not everyone has all those options available to them. After considering all our options, we started looking into medical care in Arizona. The contrast was shocking. We found a doctor almost immediately, got an appointment within a week, and when follow-up tests were required, they scheduled them the next day. Big difference. We came to the heartbreaking decision that we needed to sell our dream home in our dream location and move to a state where we can get health care. I pushed hard against it for a long time. Reality hit home, however, when my husband said to me, we're fine now, but what if something happens? This house and location are no good to me if I have to sit here and watch you die waiting to see a doctor. It's pretty hard to argue with that. We have a friend whose husband had a serious medical issue. No one in New Mexico would prioritize the surgery he needed to save his life. After months of waiting, his surgery was scheduled for the end of December. He died on December 7th. We have another friend who was diagnosed with cancer 2 years ago. The doctors in New Mexico told him they couldn't do anything. No specialists were available. He and his wife sold their home and moved back to New York so he could get care. Almost everyone we know is having the same conversation we had. We know of people who travel to Arizona, Colorado, Texas, New York, Wisconsin, and Washington for healthcare. I strongly believe that medical malpractice reform, putting reasonable limits on awards, is necessary if New Mexico wants any chance to retain the physicians we have, let alone attract new ones. Every doctor that leaves the state or closes their practice impacts thousands of New Mexicans. Every single patient they were seeing has to go through the same craziness we've been through, trying to find a new provider. I don't envy the task our legislators have in front of them, as I know the forces they're fighting against. Unlimited malpractice awards are sold as a noble cause, but the result is fewer doctors, longer waits, and families leaving the state to get care. That's not noble, it's destructive. And patients like us are the ones who pay the price.